My name is Josephine Mochache. I'm a nutritionist, Kenyatta National Hospital. So we are delighted today to welcome you on board. We want to ask you to read with us, and when you have questions, we have our QA box that you're going to drop your questions. So our World Breastfeeding Week, that is always celebrated from 1st to 7th August. So we've been running our webinars from 1st to 7th. And today, Kenyatta National Hospital Nutrition Department is delighted to welcome you for our webinar. That our theme this year is enabling breastfeeding, making a difference for working parents. So today, I'm grateful to introduce to you our speaker, who is Valerie Maleche. She's a senior nutritionist, Kenyatta National Hospital, who has wealth of information and experience in infants and young child feeding. So I want to welcome you all, and remember to drop your questions as we continue our webinar. Welcome, Valerie.
Good afternoon, everyone. Thank you, Josephine, for the kind remarks. This afternoon, our listeners, we just want to continue in the World Breastfeeding Week celebration. And even before I present these slides that are being shared, we want to appreciate the Ministry of Health Kenya that has facilitated most of the information that I shall be presenting this afternoon. Our topic of presentation today is securing a breastfeeding friendly environment at the workplace. And our objectives will be policy and legislation protecting the breastfeeding rights of working women in Kenya, situation analysis of breastfeeding in Kenya, components for creating a friendly breastfeeding workplace, benefits of workplace support for both employer and employee, capacity development to support breastfeeding in the workplace. And to start us off, we start with the policies and legislation protecting the breastfeeding rights of working women in Kenya. It is important for us to note that this is something that is in the Kenyan Constitution, and we should understand that breastfeeding is recognized as a human rights issue for babies and mothers. In Kenya, these rights are enshrined in the Constitution under the Article 53, 1C, which gives every child the right to basic nutrition, shelter, and health care. The Breast Milk Substitute, which is the Regulation and Control Act 2012, it was assented on 11th October 2012, and commencement date was on 17th December 2012. The Act provides for appropriate marketing and distribution of breast milk substitutes, safe and adequate nutrition for infants, and proper use of breast milk substitutes where necessary. I can explain on breast milk substitutes for listeners who may not be conversant. This could be anything that is given in replacement of the mother's breast milk, for example, infant formula. So the Breast Milk Substitute Regulation 2021 is a statutory instrument which seeks to give full effect to the Breast Milk Substitutes Regulation and Control Act 2012. This regulation seeks to reduce preventable infant and young child illnesses and deaths through protection, promotion, and support of optimal breastfeeding and complementary feeding and proper use of breast milk substitutes where necessary. It also promotes and protects the best interests of an infant and young child in the following ways. One, initiation of breastfeeding of the infant done within an hour of birth, and promotion, protection, and support of exclusive breastfeeding for the first 6 months of life. Secondly, there is timely introduction of appropriate, nutritionally adequate, and safe complementary food with continued breastfeeding for a period of 24 months or beyond. So the complementary food is introduced after 180 days of birth, of which the baby has been exclusively breastfed. Where necessary, breast milk substitutes and prepackaged complementary food shall be safe for the consumption by an infant or young child, and adequate and accurate information on breastfeeding and infant and young child feeding shall be available to the general public. So these are the things that we get in our facilities, where we have promotional messages and different kind of information that will keep the general public informed on what is required or expected of them in terms of infant feeding. The policy and legislation also guides the ethical interaction of manufacturers with health workers, the manner in which donations are used or received, demonstration on use, development of IEC materials, and labeling of breast milk substitutes and other designated products. So Kenya has put in place policies and legislation for providing requisite support to enable women combine work and breastfeeding. And this includes the Employment Act 2007. This act in section 29 states that a female employee shall be or is entitled to 3 months maternity leave with full pay and flexibility for short breaks to express breast milk. A male employee shall be entitled to 2 weeks paternity leave with full pay. The Health Act continues to say that all employers shall in the workplace establish lactation stations, which shall be adequately provided with necessary equipment and facilities, including hand washing equipment, refrigerators or appropriate cooling facilities, electrical outlets for breast pumps, a small table, comfortable seats, the standard of which shall be defined by the ministry responsible for matters relating to health. The lactation station shall not be located in the restrooms. All employers shall take strict measures to prevent by any direct or indirect form of promotion, marketing, and or selling of infant formula and or breast substitutes within the lactation stations. An employer shall grant all nursing employees break intervals in addition to the regular times off for meals to breastfeed or express milk. The time intervals referred to in the subsection 1 shall include the time it takes an employee to get to and from the lactation station and shall be counted as compensable hours worked, provided that such intervals shall not be more than a total of 1 hour for every 8-hour working period. So the situation analysis of breastfeeding in Kenya is illustrated as seen in the graphs that you're seeing in our slides there. And we can see from 2014, when you look at the early initiation of breastfeeding, there is also the exclusive breastfeeding and the bottle feeding. You find that the early initiation was at 62%, the prevalence. The exclusive breastfeeding was at 61%. The bottle feeding was at 22%. In 2022, those are how many years? 8 years after, we are still almost on the same level. And it means there's something that has not happened right, because the early initiation of breastfeeding remains at 60%. It has even dropped by 2%. The exclusive breastfeeding has gone to 59.7%. And bottle feeding, which was at 22%, has increased to 34%. So there's a clear indication of a shortcoming in one area, and we want to look into how we can revise those prevalences to a higher level in the coming years. The trends in exclusive breastfeeding still remain from the graph shown from 1989 up to 2022. There was a lower surging and then a sudden upward surge to 61% from 2003 to 2014. And then from 2014 to 2022, there was a stagnation with a slight drop by 1%. So we would want to go back to the upward surge that happened between 2003 to 2014 after enabling this breastfeeding, making a difference for working parents, and see whether that curve can go up like how it did from 2003 to 2014. So what are the components for creating a baby-friendly breastfeeding workplace? Working female employees have a right to an environment that enables them to successfully breastfeed. Employers also have the responsibility to promote breastfeeding-friendly workplaces by providing the following components. I will go through each component one by one. Workplace breastfeeding policy, lactation station or room or space, time, and social support structures for breastfeeding. So for the workplace breastfeeding policy, we are required to provide a minimum of 3 months paid maternity leave and 2 weeks paternity leave. That is stipulated in the Employment Act 2007, Section 29. All employees should be sensitized on the workplace breastfeeding policy. We also need to reassure breastfeeding female employees that their participation in the workforce is compatible with their reproductive function. It also outlines workplace provisions to enable female employees to maintain breastfeeding. The policy also highlights the employer's commitment to helping workers to achieve work-life balance through flexible working arrangements. We also sensitize all employees on the policy. For the lactation station or room or space, the rooms for breastfeeding employees are a valuable resource for providing privacy and convenience that mothers need for expressing breast milk. And of utmost importance to a breastfeeding employee when she returns to work is a space where she can comfortably and safely express milk during the working hours. Simple breastfeeding rooms or private spaces can be created within existing building space. The initial cost is usually a one-time expenditure other than costs involved with standard maintenance. Once established, the space can be used for a long period of time. So this means that you don't have to really have a lot of money, or I'm so sure most of our facilities can create a spot or a good space for mothers to practice lactation while at work. Allocating space. Some of the points to note when you're allocating space is the amount of space needed for the lactation station is minimal. The stations do not require a full-sized office. The size of the space should be sufficient to accommodate the requirements. And it should involve at least one breastfeeding employee and other employees with experience in milk expression. We should create awareness on the lactation station once established for optimal utilization. For equipment and supplies, we want to ensure that all equipment and supplies used are fit for intended purpose and meet the required standards. Some of the equipment and supplies could be an electrical outlet, a comfortable chair or chairs that will fit next to the table, a table or a counter for placing a breast pump, lockable lockers, a refrigerator or nearby access, a sink or nearby access with running water, a hand washing facility, disinfecting solution available for cleaning up of spills, since we know that breast milk is a body fluid. Liquid soap is also required. Breast pumps, electrical or manual, that is optional depending on what the user may prefer. Personal protective gear as appropriate. In this case, we want to consider maybe the employees working like in a health facility. They may want to wear a gown, something, remove their lab coats or anything that they have used in their workstations before they access the room, so that there's a level of infection control. Labels of various stations for easy accessibility and understanding of what to use, where and what time. Stationery and other office supplies, information, education and communication materials. Those are IEC materials through linkage with the Ministry of Health. A waste basket is also important, and a door signage. With regard to time, the Health Act 2017 provides for flexi time at the workplace in addition to the 3 months paid maternity leave stipulated in the Employment Act 2007. We should consider the following: a minimum of 60 minutes in addition to the regular breaks to be allowed for every 8 working hours. If it's practical, baby can be brought to the mother to breastfeed at work by the caregiver during the work period. We've heard of facilities where they have created a space where the mother can bring the caregiver and just come to the baby to breastfeed and then go back to her workstation. So the baby stays there with the caregiver or an assigned caregiver in that station. And that will be much better to even provide the working parent a way to enable them to breastfeed exclusively. Employers can allow breastfeeding employees to arrive to work late and or leave work early as agreed. Where applicable, home-based work for a few weeks before resuming full-time work can be allowed. So, social support structures for breastfeeding. The holistic support is a key determinant to success of optimal breastfeeding by female employees upon returning to work. And the key sources of support include, but not limited to, family, friends, community, leaders, healthcare workers, co-workers, managers or supervisors, and senior management. And so in this, in ending my presentation, this is just a call to most of us who are employers to be able to tap into this call for enabling the breastfeeding lady to be able to achieve the exclusive breastfeeding 6 months without the hindrance that is created by the work support. Thank you.
Thank you very much, Valerie, for the elaborate presentation that you've given. I want to encourage our audience that we are waiting for questions that can be addressed. And we've learned so much that working parents at the workplace should try to make a difference. So we encourage you to drop your questions. You are able to go back. There's a first question here. First question: what is your experience in promoting? There's a first question here. What is your experience in promoting workplace support in your facility?
Okay, thank you for your question. At Kenyatta National Hospital, we have a workplace facility for the breastfeeding mom, and it meets all the requirements that have been stipulated and presented in the presentation we have just had, and it is in full operational use. So we can say that we are talking from an experience that we have had as a facility.
Thank you very much, Valerie, for that question. I want also to go to the second question that has been posed here. Are there any myths or misconceptions regarding expressing milk at the workplace? Our second question is, are there any myths or misconceptions regarding expressing milk at the workplace?
Sometimes we have mothers who, or people who feel that people who are expressing milk are maybe, you have the language that is used. One of the things that we say is the mother who is expressing breast milk is dirty. We've had some people say that, and you'll find they're saying, no, we don't want them to come near our tea. We don't want them to do such things and such things for us. I want to assure all of us that, first of all, breastfeeding is a natural process that everybody goes through. And it is important, in the spirit of creating supportive communities, that we all are able to embrace our breastfeeding mothers, so that there will be no stigma or shame attached to breastfeeding. Also, I would also want to emphasize that in the workplace support rooms that are present, we need to have there is safety. For example, the one that we have in KNH is always locked unless it is in use. And that makes it such that people are not coming in and going out, and the mother is not feeling like somebody might come in and maybe run away with their milk. The rooms are safe, the rooms are comfortable, the rooms are clean, and they have everything that somebody may need in order to be able to express breast milk. Thank you so much.
Thank you very much for that question. I'm still encouraging our audience to continue dropping the questions, if there are any, before we wind up our presentation today. I'm encouraging our audience to continue dropping your questions. There's a third question here. How do male colleagues support breastfeeding? How do male colleagues support breastfeeding?
So for male colleagues, I want to imagine that they should be able to support their female counterparts who may be in the breastfeeding female counterpart should be given full support. In this case, assuming that the male colleague could be the supervisor or the manager of the female colleague, then they should be able to understand and allow this lady to be able to practice the exclusive breastfeeding by supporting her, allowing her to come late with the flexi hours that we have mentioned, allowing her to step out, maybe to rush to go and breastfeed her baby and come back in and out with no pressure, because at the end of the day, breastfeeding also starts from the mind. And if we are putting too much pressure on this employee, maybe their targets or things that the employee needs to achieve, there's too much pressure. It might reach a point where the female employee is now having a low production of milk because of stress. And so we encourage the male employee to just support, because in most scenarios, the male employees may not understand what the female employee is going through during lactation.
Thank you very much, Valerie. So there's a question from Rose Mwandawiro. Thank you for the highlights. When we talk about breastfeeding mothers to be allowed home or leave early from work, up to how many months can that be done?
Okay, thank you for the question. Our aim here is to achieve exclusive breastfeeding for the first 6 months of life. So this arrangement of being allowed to leave work early and to come a bit late is encouraged only for the first 6 months of life before we start complementary feeding. Once we achieve our exclusive breastfeeding, then we can resume the normal working hours. And then how practical is it for an hospital setup, especially anesthesia, to have flexible hours? Well, I'll say it will depend with the nature of duties that you have at your working station and also the number of staffs that you are working with. If you have somebody who can sit in for you, then it can work. You can be allowed to leave early or to come a bit late. You can also be allowed to go to the workplace support room to go and express your breast milk and come back to work. So it will depend on the arrangement that you have at your workstations.
Thank you very much. Ruth, there's a question here from Ruth. Do you encourage breastfeeding or expressing at the workplace? Under what conditions would you term exclusive breastfeeding a family planning method?
Thank you so much, Ruth, for your question. So one of the theme for this year's World Breastfeeding Week is enabling breastfeeding, making a difference for working parents. And one of the ways we can enable breastfeeding for a working mother is to make sure that they are able to express milk at their workplace. And from the presentation that we've had from our presenter, one of the things we've talked about is the Health Act 2017 that stipulates that all employers should have this facility set up for their employees. So yes, we encourage expressing of breast milk at the workplace. And when this breast is expressed, there should be a safe, appropriate sorry about that. We had a bit of a technical hitch. But from what I was saying was, as a method of family planning, exclusive breastfeeding by itself is not efficient or sufficient for any woman. It is important to have an accompanying method for that. Ruth, if you are breastfeeding and you need to be able to express breast milk, even at the workplace. Thank you.
Thank you very much. Another question from Edna Warento. Excellent presentation. My question is, was there an advocacy in previous years to increase maternity leave to 4 months to allow for more time for exclusive breastfeeding?
Thank you, Edna, for your question. I think this is something that is still somewhere behind the scenes, but I know of other countries that have the long maternity leaves of even up to 6 months. But in our country, we are not yet there for 4 months. So in this case, what we talk about is if the mother has the 3 months, that is the stipulated maternity leave, then the employer can support by allowing her to take her annual leave to add a 4th month to her time of breastfeeding so that she can be able to do the 4 months exclusively and be left with only 2 to struggle through the coming and going to work as she breastfeeds the baby and expresses milk at the workstation. So I think that one has not yet come in place yet.
Just to add on what Valerie has said, the advocacy right now is for maternity leave to be extended to 6 months. We have some organizations that have already started giving their staff members 6 months maternity leave. We have like Save the Children, they are doing 6 months maternity leave. So we are currently advocating for 6 months.
So there's another question here. I missed out on the first requirements for the breastfeeding room, apart from the one that had soap. Kindly show the slide once more. So I think we go back to our slides where we can display the requirements of the breastfeeding week.
So as they bring up the slides, some of the equipments on that slide were an electrical outlet, a comfortable chair that will fit next to a table or a counter for placing a breast pump, lockable lockers for each mother to be able to store her personal effects privately, refrigerator or nearby access, a sink or nearby access with running water, hand washing facility, and disinfecting solution available for cleaning up of all spills. I think that was the slide that you wanted. I'm not sure if we've answered that one. Maybe we can move to the next one.
Advice on how a facility can set up such a breastfeeding room. I think Valerie has already elaborated on it. Let's go to another question. The upward trajectory and later slackening in exclusive breastfeeding seem to follow years when Malezi Bora activities were introduced and taken seriously nationally. Is there a way for counties to continue the activities and implement breastfeeding regulations you cited?
Yes, I believe with the way the systems are in Kenya today, where people have gone county-wise, I think counties are empowered and they can be able to continue these activities with the help of the Ministry of Health. That is very key in supporting these activities. So I believe we can get contact persons in our counties linked to the Ministry of Health to be able to make this work.
Yes, just to add on what Valerie has said, Malezi Bora is majorly financed by partners of the Ministry of Health. So if counties want to continue with the activities of Malezi Bora and implement breastfeeding regulations, then they need to budget for the activities that are carried out during Malezi Bora activities.
And to add to that also, it is important that as health workers, we are loud. You know, sometimes as health workers in our communities, let us remember we need to support each other and the people that are around us. We need to be louder than the things that I've seen on maybe social media. You know, when you go around social media, you see maybe people who are considered celebrities and role models not breastfeeding or not practicing exclusive breastfeeding. And these things have been normalized in our society. As healthcare workers, we need to be champions of breastfeeding. To all the 1,400 people joining us today, we are all champions of breastfeeding. We should all campaign and be loud to make sure that our mothers and our communities support breastfeeding. It is all our responsibility.
Thank you very much. Let's move to another question from Kiprotich Kirui. What makes a mother to produce enough milk for a child? Because there are a number of cases where one complains of not having enough breast milk.
Thank you so much, Kipratish, for that question. So first and foremost, when one is complaining of not having enough breast milk, it is important that the mother is assessed by a qualified and trained healthcare provider so that we are able to quantify the enough. You know, some people have seen maybe their neighbors or colleague breastfeeding, and then milk is coming out in shots and is spilling everywhere. And we are comparing ourselves to that particular person. So it is important for us to have that mother assessed in order to determine if the milk that they are having is enough. Secondly, one of the things that makes it not possible to have enough milk is not emptying the breast sufficiently. Let us all remember that when we empty the breast, we are able to make more milk, literally. The longer, and why we are also now again campaigning for workplace support for for expressing breast milk. The longer the milk stays in the breast, the longer you stay without emptying your breast, then the less milk you will produce. The amount of milk that one is able to produce becomes less and less. So it is important for us to look at that part. So finally, if in case a mother feels that the child is not having enough, getting enough milk, during their antenatal, postnatal clinics, during their postnatal clinics and the well baby clinics, the mother should should always remember that the baby should be weighed and they should be following their growth curve. If your child is following their growth curve, we always say, do not be intimidated. If your child is growing appropriately for their age, then you will be producing enough milk, but be assessed by a healthcare provider. Thank you.
So maybe I can add something to the same question. Concerning the case of one complains of not having enough milk, in the scenario we are talking about the working mother, usually what happens when we come to work and we are breastfeeding, we tend to forget our feeding times. Remember, when you are at home, you are taking your snacks very frequently, hydrating with the hot, nutritious fluids every 3 hours or so. And so when you're at work, the work requirements may overwhelm you until you may not have the time to grab your healthy snack or your cup of porridge or hot chocolate. And so with that trend, and also not having a chance to express the production of the milk will definitely go down. And that is why we are insisting on these lactation stations, so that we can promote that exclusive breastfeeding within the 6 months, so that when the mother is at work, even if she's not able to reach the baby, she will express the milk and maintain lactation.
Thank you very much, Valerie. A good observation here. This is the best policy for us mothers. I had a bad experience and I have never wished anyone could experience the same. Being a supervisor, manager in a facility, be conscious enough. Thank you very much. We are grateful. Kevin Ojambo has a question here. As per the Act, can the management or one opt to have a paternity leave pushed forward?
Well, thank you, Kevin. Paternity leave should not be pushed forward for whatever reason, because immediately after delivery, that is the time when your spouse requires or needs you more to assist. I mean, you need to assist her in the recovery process after delivery. So that paternity leave should be taken immediately and should not be pushed forward.
Thank you very much for that. Question from Justice Dunda. Are breast milk substitutes allowed during the first 6 months of life?
Okay, Justus, thank you for your question. Concerning the breast milk substitutes, from the presentation, there's a statement of where necessary. And most of the time when we find ourselves using breast milk substitutes, you realize that these are critical situations whereby we may not have a mother for some reason. Maybe she's too sick, or she passed on. And so we want to just give the baby something that could be almost close to mother's milk. And that is where we can allow it during the first 6 months of life. So for a situation where there's a mother available, as a healthcare worker, I would propose that we assess the mother and the situations surrounding her ability of not being able to have enough milk for her baby or her babies, and support the mother to be able to do the exclusive breastfeeding before we think of anything else, because we want to promote exclusive breast milk in the first 6 months of life.
Thank you very much, Valerie. Another question here. Many health workers, including pediatricians, are not well trained in lactation management, so that they are unable to help the mothers with breastfeeding problems. What is the ministry doing about this?
Okay, thank you, anonymous attendee, for that question. Us as Kenyatta National Hospital, we conduct maternal, infant, and young child nutrition training to all clinical staff in our facility. And in that, it's a 5-day course, and we have lactation management as part of that training. That is where we capture our pediatricians and all the other clinical staff. The training is also open to outsiders, people who are not working at KNH, but of course there is a cost implication for that. I understand that the Ministry of Health also conducts the training, MRSN training, to counties, especially counties. Maybe you are not aware, but the Ministry of Health conducts that training to county staff, especially in the county hospitals. You can reach out to the MOH Nutrition Division for more information.
Thank you very much. There's a question here from an unanimous attendee. Considering medics work longer shifts, which may be more draining, what practical measures can be taken to support them to get the time to express breast milk while at work?
Okay, I think I can answer that one. There's a slide we spoke about time, and some of the practical measures that can be taken could be bringing the baby to the mother. That depends on the setup of where the person is working. And another thing that we've been talking about in this act and the policy is to make time to make sure the shift for the breastfeeding mother can be able to favor her to be able to rush, go breastfeed, or step aside and be able to express her milk for the baby. So I think the medics that are working longer shifts and they are lactating will not be very fair for them, because that way they shall miss out on expressing breast milk, they shall miss out on stepping out to go and breastfeed their babies. And with such progression, the production of milk may go low.
Also, to add on to that, it's important that we support our mothers. So if you are in a workplace where it is possible for somebody who is breastfeeding to be given maybe a lighter shift or to be shifted to an area with a more flexible workload, for that 1 year that they are going to, at least 1 year, the one that we're really required to have the flexible work time so that they can exclusively breastfeed and continue breastfeeding. It is important that managers and supervisors are able to provide this for them. If you are in an area where somebody is working a 12-hour, 15-hour shift, and that person can be moved to an area where they can do maybe a shorter shift, that would be great. That is part of promoting, protecting, and supporting breastfeeding. Thank you.
Thank you very much. Another question here. Is it too much to ask a client to maintain hygiene while breastfeeding? For instance, take a bath regularly and change clothes, because I really get weird smell, breast milk, which has gone up to days without taking people's bath.
It is very important that during our antenatal clinics and our postnatal clinics that we emphasize hygiene among everybody, the mothers, even the children, and everybody needs to have good hygiene. Also, let us remember, if you find somebody who maybe is not grooming themselves well, or is not taking their baths and all that, it is important as a healthcare provider to dig further and look for history. There might be other social issues that we may not be aware about, and this person may require other forms of support. Thank you.
Thank you very much. Question from Geoffrey Thuku. What is your advice on the take of drugs used to promote milk production and also those used to reduce milk production?
Thank you, Geoffrey. Nowadays, we are not advocating for drugs to promote milk production. We have in our Kenyan market, we have supplements that are meant to promote breast milk production. So we are advocating for the use of the supplements instead of the drugs, but where the supplements are not available, then the drugs are advised, but they have to be prescribed by a medical practitioner. When somebody delivers and for a reason they lose the baby, then of course we have to stop the milk production. In this case, we advocate for drugs that are meant to work towards reducing and stopping production of breast milk.
Thank you very much. Another question from our anonymous friend. Have you considered providing crane services at the workplace to also promote exclusive breastfeeding?
So as we continue with, it depends on the nature of your work. We have workplaces that have creche services, where, as my colleague Valerie was saying, that the mother has a baby brought to them and they have somewhere where they can go and sit and take care of their baby even while at work. But then again, this also depends on the nature of your work. If you're working in a health facility, this may not be very practical. But then again, before we think about the creche services, first, let us set up the workplace breastfeeding support area. Remember, it will be more resource intensive to set up a creche. So first, let us start with workplace support. Once we do that, and then more resources are available and it is appropriate for your facility where you're working, there is no harm in setting up a creche facility.
Thank you very much. Another question here. Why aren't the moms trained on manual expression of milk instead of the expensive pumps?
Maybe I can answer that. Usually in our facility, we don't use pumps even for the mothers. we just use the hand expression. We've spoken about pumps in this presentation because of the different nature of people that we would be reaching out to in the workplace setups. But if a mother is able to express with the hands, that would be much better, easier, and faster, and more, it can even be safer because she just needs to wash her hands and express into the container that she has. The person with the pump may need several gadgets and keep washing the pump. So we can say in our facility for the patients that we have, we advocate for manual expression of milk.
Thank you very much. Another question here. What happens when a mother employee is forced to go back to work when the baby is 6 weeks old?
Well, if a mother is forced to go back to work when the baby is 6 weeks old, and then that is the point when the workplace support facility comes into use. Because if a mother has no choice, they have to go back to work, then we need to make use of the workplace support facility to make sure that the mother goes to pump breast milk, which is left at home for the baby to use while the mother is working. So you can still continue exclusive breastfeeding even after going back to work when the baby is 6 weeks old, through expressing breast milk during working hours and then leaving it at home for the caregiver to continue feeding the baby using breast milk.
And also to add to that, you find a lot of the mothers who are forced to go back to work when their babies are so small are in either in informal sector or the informal sector, or depending on their employment types. So let us remember that every mother, irrespective of their contract type, irrespective of their profession, has the right to breastfeed their baby. And it is important that all of us, again, it is our responsibility to be advocates for that. If you're in a place where the mothers are not supported, and a lot of the time you find people going back to work because they feel that they need to go back to work. If you go back to work, your spot is taken, especially in the situation that we are in right now. If you don't go back to work, somebody takes your spot. This means that our mothers are not supported. It is important that those who are involved in the creating of policies are able to also capture these mothers who are in the informal sectors, and also at times even in private sector. And private sector associations, the Kenya Association of Employers, the Kenya Association of Manufacturers, all these associations should come together to ensure that every mother is able to breastfeed their child for 6 months.
Thank you very much. Another question from Pamela Sasaka. There is a scenario where you are alone on duty. How can you achieve that? I presume, how can you achieve exclusive breast milk at the workplace?
That we would say is more of a human resource issue. And we would want our human resource managers and supervisors and the human resource department in conjunction with the employer to ensure that our areas are all adequately staffed, because if our mothers are not able to express breast milk, they're not able to go and pump, we are denying the children their constitutional right to good nutrition.
Question from Safari. I think it has been answered, but I can read it. Why is it private counterparts, employer do not observe these rules as some workers fear to lose their job?
As we said, has a lot to do with the space that we are in. We are in a space where opportunities are few and far between, and we have employers who, if we can use the words, unscrupulous, who take advantage of this desperation of the citizens. It is important that the policymakers, the people who are in charge of the policies, there are people who are in charge of enforcement, and policies and enforcement can take this up so that this policy is enforced in all areas, even in private sector. Thank you so much.
Thank you very much. Question from Alice Okuda. How many breast milk banks do we have in the country? And is there anything being done to have more? I wish we could have even one in every county.
I think the breast milk bank that is in this country is in Pumwani Maternity Hospital, which is very functional and effective, and has really brought down the mortality rate of the neonates in that facility. I believe that there's a plan in the Ministry of Health to be able to have a breast milk bank in every county. And this could be a projection in the years to come. But this would be the best thing, or the way forward for us.
Thank you. The question from Stephen Oloj. What is the maximum timeline for breastfeeding? What is the maximum timeline for breastfeeding? Question from Stephen Oloj.
Well, Stephen, there's no maximum time for breastfeeding. If the policy says the minimum is supposed to be 2 years, the minimum. But if a mother wants to continue breastfeeding his or her baby, then it's allowed. There is no maximum time limit.
Thank you very much. Question from anonymous attendee. How are employers reacting or responding to the 6-month maternity leave advocacy so far?
We are not so sure of how they're responding, but if you're a Kenyan, then I believe you can imagine how they're responding to that. And we're just hoping that they can be able to agree to this, because if we reduce the comorbidities that children below 5 years get because of basic things like not exclusively breastfeeding, then you would understand that you need to keep this baby alive and well, so that the mother can be available to work fully without a lot of absenteeism in and out, because the baby is sick, the baby has to see a doctor, or those kinds of inconveniences just because of those 6 months. So I believe with more information to these employers, I'm sure they will be able to accept to the 6 months maternity leave.
Thank you very much. Another question from Margaret Obura. In a case where there is low milk production, how can you assist the infant even if you have tried to stimulate milk production and there's no positive response?
Thank you so much, Margaret. And I would want to believe that this baby will be in a healthcare setting. But if the baby has just been born, or they have been born recently, then this mother will be supported in their respective healthcare facility where they are receiving healthcare services. That way, they will be able to get assistance that is appropriate for them and for their situation. Let the mother be assessed and seen at a healthcare facility. Thank you.
Thank you very much. A question from anonymous attendee. How do we store expressed breast milk?
So expressed breast milk, when we talk of the refrigerators or the cooler, usually the expressed breast milk can stand for 8 hours at room temperature without getting spoiled. Of course, it has to be a place that is cool and not too hot. So that will depend on the kind of climate where your setup is or where the mother is. If in the fridge, when you freeze, you can freeze the milk up to 6 months, but that has to be done with proper labeling, because as you remove and administer the milk to the baby, then you need to have the first in, first out, because you might now, if you don't label whatever you have stored well, then we might give the baby, let me put it in quotes, expired breast milk.
Another question from Stephen Irungu. How is the compliance of the employed in setting you a breastfeeding station?
I would like first to say thank you to Kenyatta National Hospital, because the Kenya Health Act was enacted in 2017, and in Kenyatta National Hospital, it was put in force the next year in 2018. That is where our breastfeeding room was sent. But then in in most facilities, many employees are taking into account the importance of breastfeeding and setting up these breastfeeding stations. It would be interesting to have the experiences of other people from other facilities when they have time. We can always organize for a discussion to discuss that, so that other people will share their experiences in their respective workplaces. Thank you.
Thank you very much. Edna Warento, regarding the requirements for the breastfeeding room, is it okay to install a TV screen for sensitization stations to breastfeeding mothers? Or is there another room where sensitization can be conducted as a scheduled, not necessarily when mothers come to express or breastfeed their babies?
Edna, thank you for your question. The TV screen can be set up, but purely for the information to the mothers, so that it cannot bring distraction. So if it can just have that information, IEC materials or broadcasts that are related to expression, importance of breast milk, then that can be allowed.
Thank you very much. Another question, is there any plan to extend paternity leave? 2 weeks is not enough.
Thank you for the question. Well, 2 weeks may not be enough for the men or the gents to support the breastfeeding mother, but I haven't heard of any plan to extend the paternity leave beyond 2 weeks.
Thank you very much. Question from Emmanuel Chigamba. I work in the maternity unit. We have mothers who go up to 24 hours post-delivery without effective breast milk. In such a scenario, what do we do?
Well, the policy says that, thank you, Emmanuel. The policy says that the newborn should be fed with the mother's milk within the first hour of delivery. sometimes it's not possible to achieve that in a maternity ward. And that is where now what Valerie presented comes in. She talked of
Sorry for that technical glitch. We have another question here. Is there, my question is, does this apply to public facilities on how do you follow up in private facilities? I think that question is not well framed. We can. Another question here, how practical is it for a hospital setup, especially anesthesia, to have flexible? I think we have already done those. Let's see the ones that we've not attended to so that we continue on them. Yeah, there's a question from Dorothy. Dorothy is saying that is wonderful presentation. Thank you very much, Dorothy. Then, yes, this is the question now. Does one entitled to maternity leave after renewal of contracts? Kindly answer.
Thank you so much for that question. So this depends on the point where you are going from, where the contract was renewed. So if you're in a situation where you are going to deliver during your current contract, of course you are entitled to maternity leave, but this is subject to the employment policies at your workplace. So most of the time, it is really dependent on at what point you are at during your contract. You might find some employers. I have had personally of employers who put contracts up to the day of delivery, and then you can come back later. And we want to state that would be a very unfair practice, because this employer is denying this breastfeeding mother an opportunity to work and an opportunity to have an income for their child. So it really depends on the workplace policies, the human resource policies in your area. But if I can speak for myself and for the area that we are in, during your contract, you're also entitled to your maternity leave. Thank you.
Thank you very much. Another question. Hi, suppose a client comes to a child and welfare clinic with a 6 weeks baby, and he explains that the mother of the baby went missing and she left the baby on his own. Which is the best approach to give?
So in this scenario, the child and welfare clinic officer should establish if the client is a relative to the baby, because that is where we shall seek to understand whether the relative can support the baby or is willing to take up the baby. But if it's a child who is not known to the client, then the child and welfare officer may be tasked to place the child in a safe facility, in which case the baby will be put on a breast milk substitute to be able to sustain their feeding.
Thank you very much, anonymous attendee. What is the recommendation for babies who have lost their mothers during birth? Because we have seen guardians who come to the facility with 2-month-old babies with a jaundice, poor weight gain, and have already been started on cow's milk or goat milk because of inability to afford formula.
So that is not, that is a situation that also and also affects us as a facility, because not everyone is on the same social economic status. And sometimes we have to look at the pros and cons and work with whatever shall be available. But we have to educate the caregiver or the person, the guardian with the child, on how to give it in the best form. So again, I can say that not everyone will afford the breast milk substitute. And in this case, you're forced to assess on what can be next available, or see how they can be supported with breast milk substitutes from another angle or facility.
Thank you very much. We had another question that is following like this. Is there something like a milk bank where mothers can donate milk for these babies, or how further can they be helped?
Well, there's a milk bank in Pumwani Maternity Hospital, and any Kenyan who is willing to donate breast milk is much welcome to go and donate breast milk for those who are not having it to feed their babies.
Thank you very much. Another question. How would you handle a situation where, as breastfeeding, you are put on night shift immediately after coming from maternity leave?
We have to reiterate, like in our facility, that is not something that is common or something that happens. But it is important for us all to remember, if we have managers or supervisors listening, when we are creating our duties, let us consider the well-being of our breastfeeding employees and their children. Thank you.
Thank you very much. Another question. On maternity leave, is there a provision for mothers who have lost their babies?
In this situation, this is usually worked out depending on the issues revolving the mother, depending on the health status of the mother. And so this can be worked out through the HR unit of a given facility.
Thank you very much. Another question. To enhance optimal breastfeeding, advice it should be made mandatory for all health workers in maternity and well baby clinics to be certified in lactation management. That's a thumbs up. Thank you very much. So there's another question from Rose Mandawiro. Is it that the employer should buy the breast pumps for the employees, or each employee should buy on for hygiene purposes?
When we talk of the lactation workplace, the place for lactation in the workplace, the employee should come with their own gadgets so that we minimize the issues of infection. So the facility may not provide the pumps, because now that will also require human resource for cleaning the equipment and the equipment used in the station.
Thank you very much. There's a question from Lynette here. Suppose a breastfeeding mother breastfeeds her child in the morning and gives none during the daytime, and breastfeeds after work. Will it be wrong or is it okay? Thanks.
Well, Lynette, thank you for your question. As a breastfeeding mother, you should try as much as possible to feed your baby using only breast milk. But in situation where the breast milk is not enough, you are forced to give infant formula in between the breast milk feeds, then it will not have any negative effect on the baby, as much as you are not giving excess. But the point is that we should try our best to exclusively breastfeed our babies. If you are expressing, then you should try your best to make sure that whatever you are expressing is enough for the baby for the time that you're going to be away at work.
Thank you very much. Question here from Peter Esekon. Hi, thanks for the educative session. If you become pregnant while breastfeeding, what are the effects to the born and unborn?
If you become pregnant while you're breastfeeding, you can continue to breastfeed the baby that is already present up to later in the third trimester, up to about 6 months. Then after that, you would be encouraged to stop breastfeeding, because as you stimulate the breast, it can also stimulate contractions in the womb. So you can continue to breastfeed up to 6 months, it's okay. And there will be no harmful effects. And please, if you find yourself as a mother in this situation, make sure that your diet is adequate, that you're able to provide nutrients for both the growing baby and the one who is breastfeeding.
Thank you very much. There's a question from Margaret. When you refrigerate breast milk, it needs to be warmed. Do you think this will interfere with the milk component, or how will you maintain the correct temperature?
Margaret, thank you for your question. Usually the breast milk that is refrigerated is usually thawed in a warm water bath. So you need to remove it in good time, so that when it's being prepared for the baby, you thaw it in warm water. It is not supposed to be boiled or rewarmed in a microwave, or the way that anyone would warm any other fluid. So the temperature will be dependent on the water that you have used, and that is why we are saying it should be warm water, so that it can maintain the correct temperature.
Thank you very much. Another question from Rose. Another question from anonymous attendee. How about mothers who are so much baby formula? Is it going to have any negative impact on the baby?
Let us start from the fact that when we are feeding babies formula will never be a substitute for breast milk. Let us remember, there's a slogan, somebody talked about the Malezi Bora campaign, and we always said, ya mama ya bamba. The mother's milk has everything that the baby needs for their first 6 months of life, and continues to provide nutrients even after those 6 months. The mother's nutrient has immune protective factors. The mother's breast milk is also safe and available. You do not have to buy. It is not expensive. It is available when it is needed. It does not need to be warmed. So what does this mean? That we have fewer risks of infections. Babies who are formula fed are more likely to develop infections. Babies who are formula fed are also a lot more likely to be overweight and obese, even in their older years when they become adults. So there is a higher risk of developing lifestyle non-communicable diseases for babies who are formula fed versus babies who are breastfed. So let us remember, when we breastfeed our babies, it is not just for now, it is also for their future. Thank you.
Thank you very much. Question here from anonymous attendee. How can one get in touch with KNH concerning breastfeeding training?
Well, you can, if you want to be trained on MRICN, we conduct, as KNH, we conduct the training at least 3 sessions per year. If you are within Nairobi, you can, we do not have definite dates for conducting the training, but we usually give enough. Once we are given the go-ahead by the finance department, we usually give enough notice for the participants who are willing to participate. So if you are not near Nairobi, or if you are near Nairobi and you do not have time to come to KNH, you can call, you can find our phone contacts, the KNH website. You call and then request to be connected to the nutrition department. You will get the information about the forthcoming trainings.
Thank you very much. Question from David Waweru. Comments on wet nursing.
So if we are to make any comments with regards to wet nursing, if all of us know what wet nursing would be, is a mother has passed on, or a mother is still present, and then they have maybe a sister or a relative or somebody close to them that that can breastfeed their baby for them. Let us remember, though we encourage, there is a program that was in I think it was in Kilifi County, where even mothers were encouraged, grandmothers were encouraged to relactate, and they were able to breastfeed their babies. So it is, if it is safe for the baby, and the person who is wet nursing this child has undergone all the prerequisite health checkups, the baby who has been left by their mother would benefit more from wet nursing than they would benefit from breast milk substitutes. Thank you.
Thank you very much. We've come to almost to close. And if we do not answer your questions, we will reach out to each and everyone. But I want to thank you for attending, and we really appreciate for your time, and I hope learning has taken place. Thank you very much, and enjoy the rest of your day. Thank you very much.